Hi there, it's Dr. Jim, and I have a great topic. Healthcare after COVID-19. What is it going to look like? It appears that the number of cases and deaths may be reaching a peak, and hopefully the numbers will decline in the coming days and weeks. Many experts are now beginning to talk about what the future might look like for healthcare and medicine. COVID-19 has changed the way many people think about these things, and some wonder if these changes will outlast the epidemic. So here are some changes that have taken place very rapidly, over days, over weeks, sometimes overnight. Hospitals can be anywhere. This is an amazing thing. Traditionally, hospitals are large buildings with lots of floors and elevators, an ER, cafeteria, pharmacy, labs. You know what. The minute I say the word hospital, you get an image in your head. During this outbreak, though, temporary hospitals or field hospitals have been built, sometimes overnight, over days, in various public places like parks, convention centers, and stadiums. Some hospitals consists of nothing more than tents that have been set up in places that make strategic sense. Another change, medicine can be practiced anywhere. Excuse me. Or I should have done that. Oh boy, I got busted. I'm alone in the office with my dogs. Many professionals have discovered that medicine is no longer practiced in hospitals solely, or in doctors' offices or urgent care centers. Medicine during the pandemic can be practiced anywhere it's needed. Parking lots have been set up for drive-through diagnostic testing. Hotels and dorms have been transformed into care centers or overflow centers. Another change. Who are the healthcare providers? COVID-19 has transformed who can deliver certain levels and types of care, as an all-hands-on-deck model is necessary to perform increased volumes of care. In addition, doctors and nurses are overwhelmed, and many are experiencing burnout like never before. Some are falling ill and have been removed from the workforce altogether. Non-care staff are quickly learning how to provide much needed services. We have not seen that maybe since World War II. Another, quickly changing rules. Rules and regulations, they're changing. The question is, are they going to stay in place, or are they going to get changed again after the crisis is over? Doctors and nurses who were originally dedicated to elective treatments have been pulled to care for those with COVID-19. Fourth-year medical students are graduating early and joining forces in very unprecedented ways. Nurse practitioners and physician assistants are temporarily allowed to perform various treatments and with no physician supervision. The debate over more or fewer hospital beds. I've been hearing this one for, oh my gosh, a decade or two. Prior to this pandemic, there was a nationwide push to actually reduce the number of hospital beds, especially in smaller community hospitals. During the outbreak, though, there don't seem to be enough hospital beds, and care is being delivered on naval ships on the East and West Coast, for example. And while it's true that American medicine has focused on acute care, an evolution has taken place, turning its focus to chronic care, which can be delivered outside of the hospital. So in the middle of this pandemic, should we ask for more or fewer beds? And once it's done, where do we go from there? Another change. Your doctor will see you now on your smart device. Before COVID-19, there was a lot of debate over the growth and the future of telemedicine. Insurance companies resisted paying for it and did not deem it a necessary service. If it's not necessary, you don't get paid. Right now, it seems like telemedicine is saving the day, and it seems like it might be saving a lot of lives. The current increase in telemedicine is not due only to the virus itself, but to the temporary lifting of barriers concerning regulations and reimbursement from insurance companies. Let's see what happens after the crisis is over. And then something that I talk a lot about, big pharma, massive, worldwide drug companies. What comes to your mind when I say big pharma? Okay, this is yet another area where public opinion has dramatically shifted. The winds of change. Prior to COVID-19, there were lots of social movements to reduce the power and the political influence of big pharma in our country and around the world. There was such anger and outrage at the high cost of drugs and how people who really need them can't afford them. Now it seems that society as a whole, we're cheering for big pharma to find treatments, vaccines, and cures for this illness and others that might be coming. My final thoughts. Changes taking place in society is nothing new and have occurred since the beginning of civilization itself. What's different about changes taking place due to the coronavirus is the amazing speed at which they are occurring. Rules are changing overnight. Regulations are loosening. Insurance companies are paying for care and services not previously covered or deemed necessary. The big question on lots of people's minds, I know it's on mine, is, will these changes continue to live on after the pandemic is over? Or will we return to healthcare and medicine as we knew them before the virus? Lots of questions, and with these changes in healthcare come a lot of ethical dilemmas and ethical problems. We will be seeing a lot of changes, reversals, new rules, policies, procedures, loosening of them, and ethical issues all over the place. So stay tuned, come back for more. My name is Dr. Jim, and thank you for spending some time with me.